This is a presentation on highly educated nurses, higher quality of care by Jesslyn Knoll. 3 learning objectives for this presentation are that at the end of the presentation, the learner will be able to do the following. State how research has shown that bachelor degree nurses positively affect patient mortality rates. State 3 additional topics that are focused on in baccalaureate nursing programs. And describe how the baccalaureate prepared nurse decreases cost for the healthcare system. The relevance of this issue to nursing practice and the whole healthcare system is that nursing is the only health profession that allows multiple pathways to entry-level practice. The 3 educational routes to obtain an RN license are a diploma, an associate's degree, or a baccalaureate degree. 55% of the nursing workforce has a bachelor's degree or higher as of 2015. All nurses must sit for the NCLEX exam to obtain their RN license. This exam assesses the minimum competence for a safe RN. The ability to pass the NCLEX does not differentiate between graduate nurses' knowledge. It does not assess outcomes over time or test the knowledge and skills specifically developed in a baccalaureate degree program. And here's the kicker relevance fact. Evidence has shown that baccalaureate prepared nurses improve patient outcomes. In fact, a 10% increase in baccalaureate prepared nurses in a hospital system decreases the patient mortality by 5% in that hospital. This is a study done in 2003 by Linda Aiken of the University of Pennsylvania School of Nursing. It was the first of this kind published, and since then it has been replicated, producing the same results in several studies, hospitals, and countries. Influence on nursing practice. The ANA, American Nurses Association, developed this goal to increase the proportion of BSN nurses to 80% by 2020. The ANA also recommends that all nurses should pursue a BSN within 10 years of initial licensure. And interventions that the state of Ohio is doing to achieve this goal of BSN within 10 is offering BSN programs through community colleges that typically only offered ASN degrees, increasing the RN to MSN acceleration programs for nurses with previous bachelor's degrees, and increasing shared statewide or regional curricula to eliminate credit transfer problems to encourage the nurses with previous degrees to go back to school knowing that they'll have less credits to take. And the specific knowledge that is only taught in BSN curriculum that our ASN nurses miss out on is the focus on evidence-based practice. Leadership and management is also taught, research, statistics, and population-based care, and the humanities. Influential nursing practice continued, and this is kind of specific to the workforce. 82% of BSN graduates have been hired within 18 months compared to 60% of associate degree nurses. This has been a shift because previously 85% of ADN graduates were hired within 18 months. So we can see that now hospitals are starting to prefer the BSN graduates over the ADN. Statistically significant difference in the unemployment between BSN and ADN nurses, and really overall unemployment in nurses is very low, but again, hospitals are holding on to the BSN nurses. And the percentage of ADN nurses is increasing in long-term care and physicians' offices as, again, the hospitals are preferring to hire these BSN nurses. And also the RN to BSN education trend was really introduced in 2011, and this just influenced nursing practice, again, by encouraging these ASN nurses to go back for their bachelor's degree. The BSN initiative influence on healthcare. The new recommendations state that 80% of the RN workforce should have a bachelor's of science in nursing. And the reason is that these BSN nurses can lower readmission rates and decrease the length of stay for patients because they are better equipped to lower the incidence of failure to rescue hospital-acquired pressure ulcers and post-op DVTs, and PEs. And the cost savings through the lower readmission rates and decreased length of stay is equivalent to the expense of increasing the number of BSN nurses. As these adverse events decrease, Medicare and insurance reimbursement for the healthcare system increases. And I just had this quote that I wanted to share from the National League of Nursing. It says, education progression will help the nursing profession to practice effectively in a healthcare environment that includes shorter hospital stays, higher patient acuity, increasing numbers of older adults with multiple chronic conditions, and the rapid technological advances and proliferation of drug therapies. Nurses are going to be able to keep up with changes in healthcare because of a bachelor's degree, and they'll also have improved collaboration between the interdisciplinary team because of their increased knowledge of their own professional role, their increased ability to solve problems, and improved communication skills. The influence of BSN nurses on society is simply that BSN nurses have been shown to get better patient outcomes. Magnet hospitals have 14% lower mortality rates, and this is attributed to the higher percentage of BSN nurses that magnet hospitals have. And patient safety events cost Medicare $73 billion in a 2-year period, and also 79,000 preventable deaths were attributed to nursing, maybe not totally nursing, but things that could have maybe been prevented or attributed to some degree by uneducated nursing care. So in conclusion, bachelor's degree nurses affect patient mortality, and I'll just state the facts one more time. A 10% increase in BSN nurses per hospital results in a 5% decrease in patient mortality. Bachelor's degree nurses contribute to lower readmission rates and decreased length of stay by preventing complications during admission, which lowers costs for the healthcare system. And BSN nurses' education is enhanced through studying evidence-based practice, leadership, research, and humanities. And the bachelor's degree enables the nurse to keep up with rapid changes in healthcare and improve communication with the interdisciplinary team. Here are my references. Thank you for reviewing this presentation.